who here knows someone with a disorder and can tell us a little bit about the symptoms of someone you know? You don't have to be explicit and say who it is. But just some of the symptoms that are observed by you in terms of maybe someone who's clinically disordered. Yes? It could be any disorder. Sure. Okay, so obsessive compulsive disorder, right? And what are some of the behaviors they exhibit, or what are some of their symptoms? But rather, what are some of the behaviors? Okay, so there's anxiety about doing things a certain way and having things done a certain way. What else? Anything else you could think of? So you said walking a certain way?
Yeah, it's like postures, so.
Okay, so avoidance. Avoidance of germs or bacteria. All right. And remember we said we don't necessarily know where the disorder may have come from. So if we're talking OCD, right, we can have theories and models. And who remembers what Freud would say if it came to obsessive compulsive disorder? What would Freud say it came from? Why would Freud say people are OCD? What phase in their life would lend itself to be OCD? Yeah, right? We say people who are OCD might be called anal retentive. And we said there was the anal phase, which was double potty training, right? So we're like, well, sometimes if you're potty trained too early, if your parents are really strict and stringent, that could lend itself later in life for you to be particularly anal about it, right? You want things to be a certain way. If they're not a certain way, you have extreme anxiety. In which case, we're going to talk about anxiety disorders, well, many anxiety disorders and panic attacks as well too. Anyone else? Know anyone with a psychological disorder? And maybe some of the behaviors that come with it? Right, so I had I come from a huge family, right? So it's 11 of us, and I'm the baby, right, of the family. So I get the luxury of observing everyone. It's probably why I became a psychologist, right? So you think my whole life is just observing a bunch of siblings, family members, do all sorts of crazy stuff, and just curious as to why they do it, you know? But one of my sisters had eventually hit schizophrenia later on in life. And I think she may have had symptoms of it earlier on, but no one really paid that much attention to it. Or she was more functional. But as she got older, it got pretty bad, right? So like in her 40s, began to manifest itself pretty outwardly, right? In which case it was hearing voices. It was hearing voices that were not there, speaking of people who were not present, thinking of things that did not happen, right? Having anxiety or fears of things that were completely irrational, emotional. But we believe that hers could have been attributed to like a head injury she experienced like as a teenager, right? Something that she didn't really get treated properly, maybe didn't manage very well, or was not paid attention to. So the thing is, these disorders can manifest themselves at any point in life, right? There's a lot of issues that can come about at any point, whether you're a senior citizen, elderly, or teenager, or early adulthood, or midlife. Yes?
So the person I was talking about kind of developed OCD more severely after 30.
Mhm.
So I don't know if she had it like previously, but this wasn't as bad.
Yeah.
And what happened?
Yeah, so you think many times there's a catalyst, right? There's something that takes place that may exacerbate something that was previously there, right? So you're saying with COVID, right? You could say someone who was mildly OCD, normally OCD, right? They're very organized, they wash their hands a lot, they like to keep clean, right? Keep hand sanitizer. But then COVID comes, and guess what? At the beginning, pretty much everybody was spraying. Like, you were wiping down, like, your grocery bag and the boxes that you brought in the house from Mariano's or Jewel. Like, you were wiping down literally anything that was exposed outside of the home. And so you can imagine the people who've already had mild symptoms of OCD, what that did to them, right? Versus just the normal people who don't have OCD. Like, it made us kind of OCD, right? So yeah, typically there can be a catalyst, or it just can be enduring and ongoing, right? If people are stressed, you know, as an early adult, early adulthood, then you probably can go back and trace and say, oh, they were kind of a stressed out kid too, right? They were pretty stressed out on the playground or in elementary school. Or sometimes something can trigger us to think of high school. So you go to high school and now you're completely bullied for whatever reason, right? Maybe how you look, so you don't get along in social groups, right? Somehow you just don't fit in. You try very hard, it doesn't make sense, right? You can have adapt sort of personality disorders, mood disorders, dissociative disorders, right? Things can manifest itself by the catalyst of going through 4 years of high school, experience all sorts of trauma in some sense, right? So things come on when they come on. There's a lot of multi-factor layers to it. All right, so we talked about before, okay, we had medical models, hospitals replaced asylums. We said before this happened, people were generally put in an asylum. Family members rarely ever showed up because they were seen as a broken human being. Essentially, they were seen as broken. They were not going to contribute the way we want people to contribute in society. And so people essentially discarded away and experimented on, right? Families really seeing you, the people at the facilities would typically experiment on you, lobotomies, electrotherapy, all these different things. And then we had the hospitals replace the asylums, right? So mental illness were kind of more classified, diagnosed on the basis of symptoms, treated through therapy, and cured. So we started to approach the human mind in the same way we started to approach other parts of the body. So what are the symptoms? Can we treat this? Is it curable? In which case we would call therapy. And then we had a biopsychosocial approach, right? Studies how biological, psychological, and sociocultural factors interact to produce specific psychological disorders. And vulnerability stress model and epigenetics, right? So we start to look at, hey, not only is it some sort of genetic influence why people behave a certain way, or maybe because people are disordered, there's some other factors attributed to it, right? The outside world, the environment, the culture may be impacting how one behaves. All right, classifying disorders and labeling people, right? Classification aims to predict the disorder future course, suggest appropriate treatment and prompt research, so we label people, right? We label people who are disordered. We just say, hey, this person's ADHD, ADD, right? Or this person OCD. We give labels. There's positive and negative. So we say, well, I see the bad stuff in that. We give them it could be perceived as a negative connotation to label someone as that because maybe in their world they have to carry that wisdom everywhere they go, and they're constantly thinking that there's something wrong with them in reference to other people. Right? Something's wrong with them, other people have it better than them, so nothing's wrong. But we do need to classify in order to organize our research, to be able to treat, to be able to speak the language amongst each other as professionals to try to address the situation. Right? So it's kind of a two-pronged effect, right? One positive, one negative. I talked before about the Bible of Psychological Disorders, which is the DSM, Diagnostic and Statistical Manual of Mental Disorders. That's in its fifth edition. We also have the ICD that deals with the United Nations, the World Health Organization. And you could Google that, they have a classification for every disease imaginable. Every kind of physiological disease to mental disease. And obviously when COVID came out, we heard a lot from the World Health Organization because it's looking around multiple countries in order to classify diseases. And then we got the National Institute of Mental Health Research and Domain, or RDOC. All right, some things that have changed in DSM-5. So the DSM, right, the Bible, the manual, it evolves over time. Things get taken out, things get added in because we start to learn more about mental disorders and human behavior, and social things change, cultural things change. So here we're saying, here's some changes in this latest edition, autism and Asperger's syndrome is equal to autism spectrum disorder, right? So I'm pretty sure autism is a big one, right? Autism is huge. My kids are in daycare, and we always hear them talking about other students like, oh, you may believe that they may be on the spectrum, right? So typically you hear spectrum. But those are not professionals, right? So generally random general people observing people go, oh, I think this person may be on the spectrum or something like that. Like, no, you have to look at the criteria. There's a whole list of things, right? And the thing with putting this on the spectrum, we're like, well, this is so big. It's too much stuff under there, right? This may actually be a negative thing if we think about it. And why we do that, who knows why we did that? Maybe it was a cultural thing, right? Maybe we want to generalize people more, just to make them not feel as bad about their treatment. Or there could be other reasons. All right, so we changed mental retardation into intellectual disability. Right, so we're changing the verbiage of things. Before it's mental retardation, now it's intellectual disability. Hoarding disorder and binge eating disorder added, right? Some criticisms, right? Writer that pathologizes everyday life is too broad. So we say here, what, the spectrum, that might be too broad, right? There's so many things underneath that spectrum. Subjective diagnostic labels and biasing power of labels. Right? Once again, as human beings, we tend to judge people with our biases or prejudice based on how we view or where we come from or how we think things should be. So this could give a lot of power to that bias. All right, some controversy over ADHD, right? This is big for high school individuals or elementary individuals, right? But many people do not take into account. One of the things is dealing with boys, right? So with young boys, you think of, hey, let's say a teacher randomly suggests that, like, hey, I think this kid has ADHD. Why? They can't seem to pay attention, right? Why would that be considered ADHD? Like, why in a general sense that can be considered ADHD? Like, that's too general to just suggest that. What are some reasons why somebody wouldn't pay attention? Yes?
Class is interesting.
It's not interesting, right? You think about it. The human mind is seeking homeostasis, as we said, whether you're conscious of it or unconscious, right? So you're unconscious about things that you do that make your mind drift. But think about it. Even now, your mind's drifting as I'm talking. You're not doing the drifting. So you're rarely driving the car. Remember I said about in a 24-hour cycle, you're about 10% conscious. The rest of it is automatic drifting. You're drifting, you're thinking about stuff. Whatever you're thinking about right now, you're thinking about, what am I gonna do tomorrow? Later? This stuff is boring. This stuff is this. Let me look at Instagram. You're thinking about a gazillion things. And you're not even doing the driving. Right? So we say that you as a particular individual, where you come from, your culture, your genetics, your environment, all the stuff you got going in your life is leading you to have thoughts and emotions that's drifting towards something. Because we all aren't interested in the same stuff. You're interested in what you're interested in, right? And so when the stuff's not interesting, it may cause you anxiety to force yourself to be interested. So if you're trying to tell kids who are not, really small kids who are not very conscious of their own mind, right? We say we're conscious, but we're still very limited in our consciousness. The small children are not very conscious or aware of their own mind or their behavior. It's probably a lot more difficult to address the boredom or the lack of interest, right? Or they're exploring to find the interest, the things that they're interested in. So ADHD is very broad, very skeptical. I say up to a certain age. Now at a certain age, say if you're mid-20s or something, and you particularly couldn't keep a job, right? You're very poor at the job you do because you're not able to focus. Yeah, that might be a real issue, right? But in the early stages of life, we could say this could be controversial, right? So there's controversy over the diagnoses, the symptoms, right? Skeptics versus supporters, right? Some people want to label people ADHD because they're like, well, this gets some treatment. If we avoid it, then we never get people treatment that could potentially exacerbate those symptoms in the future as adults, right? So maybe we're trying to help curb some of that, those symptoms. The causes and the treatment. Right, so the causes. When you say boredom, you can say someone's just hyperactive. When we say someone is extremely extroverted, would that make them hyperactive? Right, someone's extremely energetic, very motivated. Right, they could be perceived as being hyperactive in some sense. All right, so the bottom line of it, extreme inattention, hyperactivity, and impulsivity can derail social, academic, and work achievement. So when we do classify someone as having ADHD, right, we say it needs to be extreme, right? It needs to be pretty extreme because some of us are motivated, energetic, et cetera, et cetera. So it needs to be extreme in the ability to not pay attention, inattention. It needs to be extreme hyperactivity and very impulsive, right? Not able to control their actual behavior, which will derail social, academic, and work achievement. It's going to impact your life, right? It's going to impact your life horribly in some way. And once we say with disorders, it's either really impacting you, it's bothering you, or it's impacting other people. In this case, probably impacting both. It's impacting you because you'll never get ahead. Right? These symptoms can be treated with medication and other therapies. We'll talk about medication, I think, next week. The debate continues over whether normal high energy is too often diagnosed as a psychiatric disorder and whether there is a cost to the long-term use of stimulant drugs in ADHD, which means that, guess what, all drugs have side effects. And if you take all drugs long enough, your body has become used to them, and now you need more drugs and more, and eventually something else fails, right? Or you're just too reliant on it. So without the drugs, you're no good, right? That's a problem too. Like, who wants to stay on medication forever? Nobody does, right? You want to eventually try to figure out the resolution mentally without the drug. All right, risk of harming yourself and others, understanding suicide. Suicide risk increases with anxiety and depression, right? So suicide is the sense of hopelessness, right? This whole sense of hopelessness. Life is meaningless. There's no point to any of this stuff. And it increases with anxiety or depression. Either we have too much stuff on our mind, or we're too bombarded with life itself. It's just, this is too much, too complex, and we may think the only way out is to end it all, right? Or you're in a depressed mood. So you say, well, right now, I feel really crappy, right? Right now, this happened, broke up, boyfriend, girlfriend, I lost my job, I'm broke, I don't have any money, my family stopped talking to me, I moved, I'm isolated myself. Right? And you see that there's no potential for it to change. That you have no forward thought of thinking, maybe in a year or two, I might have 10 times as much of all of this, right? There's no thinking about the future. There's more so sulking and embedding yourself into the present moment too much. And guess what? It's easy for all of our minds to drift that way, right? It's easy for everyone to drift towards some sort of ideas of suicidality. Very easy, right? Someone could start a conversation that'll make us think. No, that's a good point. No, we're all gonna die. Nobody makes it out alive? Nobody. Not your grandma, not your children, not your grandchildren, not your dog. No one makes it out alive. 1,000 years from now, no one even know you ever existed, right? So we'll think, someone was to have the conversation like, oh, that's kind of true, whatever. But the point is not to allow those things to enter your mind to be a sense of irrationality. Yes, we all know that is true, that is reality, but we don't want to irrationalize to the point of where it impacts our daily life. The risk increase with the rebound of these disorders, which are dealing with anxiety and depression. So anxiety and depression are things that really need to be taken care of, because what happens is depression sometimes gets worse and worse and worse. You have bouts of it, but over time as you age, it will exacerbate itself over time. So I even say for myself, you know, I'm a kind of a California dude. I'm a traveling guy. I like to travel all over the world. So when I'm in Chicago in the middle of November, December, January, February, yeah, I'm probably kind of depressed. Maybe mild, suffer seasonal depression, right? Seasonal, like there's no sun out, I hate this place, snow, and warm up your car. And then social suggestions may trigger suicide, right? Taking in people's negative views. Being around negativity can trigger suicidality, right? Now, an interesting thing with men versus women, I think I've said this in earlier classes, men have a higher rate of suicide, women have a higher rate of suicide attempts, right? Which means that men typically, the issue with men is, I'm generalizing here, but typically men don't seek out the treatment for their issues. So if they're facing depression, a lot of times with men it's seen as a form of weakness, therefore we may not even tell nobody we're depressed, right? We may think we're all good and happy, but we could be facing some really mental issues, and it can exacerbate itself. And eventually men are very kind of pragmatic in the use of tools, right? One of them is a gun. The men probably have easier access to firearms, and boom, it's done, right? Whereas women is maybe a little bit more tricky on the emotional side, a little bit more complex. Maybe it's a leading up to it. So they say suicide attempts, right? Some researchers theorize that it's more for seeking attention at many times, which means that women participate more in cutting, right? Not finishing the job of cutting because trying to get attention of some sort about an issue that's going on at the present moment, right? But either way, suicide is still a huge problem, and it's often unpredictable, right? Particularly with men, because men don't necessarily seek out treatment or even tell people, express to friends and family that they're experiencing depression or anxiety for that matter. All right, suicide rates, there's some other differences, right? National differences. U.S. has a pretty high suicide rate, but there's a lot of other countries that have high suicide rate. I think Japan is pretty up there too, right? Because for some ways in other cultures, the perspective may be that it's a noble thing to rid yourself of your life so that you don't bother other people, right? Whereas here, we may say, hey, a little bit more complex, we might have to get some treatment. Racial differences, yes?
was gonna ask, the question about mental disorders in men. If you have one, is there any reason to have more?
Yeah, I mean, you can suffer from many disorders at the same time. I mean, you think about it, when it comes to anxiety disorders, you could say anxiety and depression can lead to like disassociative disorders, mood disorders, right? Because you're under a lot of stress or a lot of fear or a lot of phobias of some sort. Anything that would deal with kind of social disorders. So if you're facing anxiety, it's probably gonna impact the way you interact with family, friends, coworkers. You know, you can probably maybe easily triggered with things, you're bottling up things. So yeah, you can suffer from many different ones. Racial differences, right? We could say maybe white males have a higher suicidality than maybe Latino males, maybe black men, right? But, well, why is that, Professor Ross? Oh, that's an interesting question, why that would be, right? What is some of the theories that you would have? Let's say just any racial differences. Why would there be a difference in suicide rates amongst different races of people? Yes.
Different challenges, different races face, there's more discrimination against someone or other.
Yeah, let's say there's more pressure. So, right, let's say as a black man, you might, hey, there might be less pressure on me, social pressure, to reach a certain status, right? You're like, well, that could mean that you might have less anxiety. In some sense, let's say a financial sense, right? There could be high anxiety in towards of being discriminated against and prejudiced on a daily basis. But in terms of white men, you could say, well, there's a higher expectation, maybe financially, right? Because it's the majority of the country, right? They hold more of the wealth. And so if you're not meeting those expectations and standards, there's a lot of pressure on you, right? There's expectations. Your social group amongst other white people may be like, hey, you really are failing. Like amongst us, you're at the bottom, right? And so places like in Appalachia, which is like near Tennessee, North Carolina, South Carolina, Virginia, you see a high suicide rate amongst like white men, right? Because they're considered low socioeconomic status. So if in your tribe, in your group, you're perceived as the bottom of the barrel, you probably may have more depression, more anxiety, more substance abuse. You're drinking, you're taking all types of stuff, try to curb some of those social ills, right? And now if you're a minority, you're like, well, financially, maybe it was never expected for me to have this much money or to do these things, right? Maybe my culture or being a minority in this country, the forces are not as great. Right? So it's all really about perspective, and it's about your environment, and it's about your culture, and it's about the society in which you're in. Trait differences, right? Age differences and trends. Why would there be difference in suicidality in terms of age? Like, give me some age groups where you think suicide rate